Good afternoon, everyone. We want to welcome you to the Healthy Flint Research Coordinating Center Flint Community Webinar on Coronavirus, June 5th, 2020. I'm your host today. My name is Yvonne Lewis, and I am one of the co-directors of the Healthy Flint Research Coordinating Center, this organization that's bringing this webinar to you today. And we're so delighted to have this opportunity for you to join us. The Healthy Flint Research Coordinating Center is a multi-institutional partnership led by a strong community core. We have academic partners as well at the University of Michigan, Flint, and Ann Arbor campuses, as well as Michigan State University. We are also streaming live, so we'd like to welcome all of you that have joined us by YouTube and maybe even by Facebook today. We want to, again, welcome you to participate in this webinar. There will be an opportunity for you to ask questions. For those of you that have the information at the bottom of your screen, you know that you can go in and put questions into that chat. I'll mention this a couple of times a day. We have a phenomenal group of community partners who have joined us every week to be a part of this webinar and to answer any questions that you might have. For those of you who cannot see our screen today, we have Dr. Deborah Holden, who is from Michigan State University. Deborah is also a co-director of the Healthy Flint Research Coordinating Center. Gary Jones, who is out of the office of Governor Whitmer's office, the Flint Community Liaison. We have representatives from the Genesee County Health Department, including Kim Van Slyke and Suzanne Koopel, excuse me. We're looking forward to having representation from the Greater Flint Health Coalition. On our call today is Nicole Anderson. And Jim Melanowski from the Genesee Health Plan will also be joining us. We're looking for representation from the city of Flint, including Dr. Lawrence Reynolds, as well as Brian Larkin. Brian Larkin is the Chief of Staff of the city of Flint. And there may be others that will be also joining us today. So I want you to really be mindful that you can go down to the bottom of your screen and make sure that you can answer any questions. We can answer any questions that you might have. I also want to mention that Afton Shavers is on the webinar as a panelist today. And if I did not, I want to mention again, Dr. Susan Wolford from the University of Michigan Flint, who will give us a medical perspective a little bit later on. Today, our nation continues to face very, very challenging times, and we cannot ignore the issues that we're facing. Even with the work that we're doing here today, we want to acknowledge that this is a moment in time in history that we will all remember. And the question is, how will we remember this moment in time? I've come to understand that this season gives us a real glimpse of the worst of our nation as well as the best of our nation. We witnessed the unfortunate and heart-wrenching scene of an African-American man losing his life, followed by an outcry of representative voices across this nation and across the world, speaking of the issues of racism, police brutality, and the overwhelming experience that we're having with health disparities. We want to appreciate, however, the manner that Flint, particularly Flint, Genesee County, has handled this issue. We've been, we made national news again, national news as the water crisis, and here we've made national news again, but it's good news for us, having been an example of how to deal with our challenges and our frustrations and our concerns in a way that represents the desire and need to work together. So we really want to make sure that we lift up those things that are positive and yet not be afraid to address those things that are challenging. We want to remind you today and encourage you, all of us, we must continue to be aware of the importance of being careful in this time. Even as we're out to make our voices heard, it is important to wear our mask, our face coverings, and to do those things in safe distancing that will ensure that we don't have a rise of the epidemic and that we are being careful and being safe. For those of you who are joining us by YouTube, you may not have the opportunity to put a question in the webinar, but we want to encourage you to send your question in to the HFRCC website at info@hfrcc.org, or you may call and text to 810-835-2130, 810-835-2130. If you, again, are watching by webinar, I want you to go down to the bottom of your screen and please be sure to put that question in so our panelists will answer those questions for you. We started a conversation last week with Dr. Deborah Furholden because we've received many questions from our community about the task force, the work that's being done on racial disparities. And of course, this is huge for us right now, racial disparities, and what does this really mean? We're also being asked a number of questions about the epidemiology or about the origins of the disease and how do we track it? How do we make sure that we protect ourselves and keep ourselves safe? So we're gonna ask Dr. Deborah Furholden if she would now open our conversation up today as a representative of the Michigan Corona Task Force on Racial Disparities and also the local task force here in Flint, Genesee County. Dr. Furholden.
Thank you, Yvonne, and welcome everybody. I'm gonna reiterate some messages that we've heard. We all know we're moving toward reopening. We're gonna hear from Gary Jones about what that looks like, so I'm not gonna go over that. I just wanna remind you of the very important personal protections for reopening. So I had to add this in and state it explicitly and not assume it's a given. It's very important that you continue to wash your hands. I was sharing with somebody the other day that we don't realize or appreciate that, you know, when we were kids and we came in for dinner, your mom always said, wash your hands. And sometimes they said, wash your hands and your face. These are practices that were born out of our flu epidemic of 1920. They've just been handed down as good practices, and somehow we lost sight of them. That is probably the best, most sort of personal responsibility that one could take during this epidemic is to keep your hands clean. And when you're outside of the house, to make sure that you are sanitizing your hands and clearly not touching your face. Do use your personal protection equipment. We did a demonstration last week, so we won't revisit that. If anybody's interested, you can go on the YouTube channel and check it out from last week on how to properly apply and remove your gloves, as well as how to properly apply and remove a face covering. And what's important to note is that anything that's external potentially has been exposed. So it's important when you're taking off your face mask that you not do it by pulling on the front of the mask. Similarly, when you take your gloves off, that you not cross-contaminate. So you pinch, you take it off, you take your ungloved hand, you stick it inside, you roll it down, and then all of that goes in the trash. If you're touching the outside of your personal protective equipment, you run the risk of cross-contamination and actually getting the virus on whatever surfaces you touch or on your hands. We ask that people continue to practice physical and social distancing, continue to work on boosting your immune system. That includes not smoking, limiting alcohol consumption, 30 minutes a day of daily physical activity, and the most healthy, nutrient-rich food that's available, consuming that. Also, it's important to stay abreast of current information. We're going to get a lot of current information. It's important to know when are curfew laws being relaxed? What are the trends as far as new cases and hospitalizations in your community? And again, I just reiterate, I believe our local sources of information are our best and most credible sources. That information is being vetted by our partners at the health department, by the Greater Flint Health Coalition, by the Community Foundation, by our local hospitals. So please do stay abreast of current information, relying on our local trusted messengers. And then I just encourage everybody to make choices that make sense for you and your family. I think the best choice for people right now is to limit their exposure and to practice these just very basic but really important safety protocols. So I want to just quickly say that we are in action around our Greater Flint local task force on racial inequity. That was sort of stood up by our partners at the Community Foundation of Greater Flint, but it includes many, many partners and sectors across the city. The work of those groups is ongoing. We are creating several guidance documents, as well as working in partnerships on very important initiatives to help us, one, slow the spread, but also to make sure that people have access to the resources and the information that they need. So it's resources and information. And I just wanted to, again, call attention to the Greater Flint Urgent Relief Fund. If you have questions about the relief fund, if you are in need of relief, you can send any of those questions to Relief Fund, RELIEFFUND, Relief Fund at cfgf.org. Thank you, Yvonne.
Thank you, Dr. Deborah. And as you know, it's often challenging when we talk about these big words, epidemiology and all the scientific terms, but we appreciate you bringing it down to a level that, and we don't want to call it dumb it down. We just want to make sure that it's clear, that we understand those big terms really mean some very simple things.
Yeah.
Universal precautions means wash your hands, right?
Wash your hands. And people keep asking, so I want to say one quick thing, which is that people, I've had a lot of times people say, what is a pandemic, right? And so I'm an epidemiologist. Epidemiology is the study of diseases and disease outbreaks. When we have an outbreak, and that's called an epidemic, when we have an outbreak of a disease. And when that disease outbreak affects the world, so it's global, it's in multiple countries. Pan, the root of pan is world. It's a worldwide epidemic. Epidemic can be in a community or in a state or in a country, but when it affects multiple countries, we call it a pandemic. So let's not forget, we are in the middle of a global epidemic or a pandemic.
Thank you, Doctor, for bringing that forward, because one of the reasons we're doing this webinar is that we can take this global issue and make it and give it a local context. Because in the midst of all of these things that are going on, it's important for us to know what we can do here in our local community. And that's why we're appreciative that the city is a partner with us in this work. The city of Flint has put together a Blue Ribbon Committee. They're working on a number of these task forces that you hear about. You may not always hear City of Flint, but I want you to know City of Flint is intricately involved. And we're going to start this part of the discussion off with Dr. Lawrence Reynolds, who's the health advisor for the City of Flint, to give us some updates on what's going on with the city from the city's perspective, and if he can give us even some insights on the Blue Ribbon Committee. Dr. Reynolds.
He is unmuted and on.
He is on music, Dr. Reynolds. Okay, Dr. Reynolds,
Can you hear me now?
I can hear you now. Thank you.
All right. I was just reviewing a news release from the city of Flint. There is a break in the water main that services Northwestern High School. So in the process of shutting down the water main for repair, a valve broke. To fix this issue, the city of Flint had to shut off water at a different valve, which is causing a temporary loss of water service for a couple of blocks of residents near the school. This service interruption is expected to last no longer than 2 hours. Due to the pressure loss, there may be trapped air and loose sediment in the water lines in the immediate vicinity. After service is restored, residents impacted by the water shutoff are advised to run cold water for several minutes, and I would say 3 to 5 minutes until the water is clear, to flush their water lines. So, you know, life goes on in the city, even with a skeleton staff and City Hall closed. There are things that we must address constantly. Yes, there has been a meeting of the Blue Ribbon Committee, and they are in the final stages of talking with businesses, churches, food and restaurants and bar facilities, hairdressers, and sometimes we are ahead of the governor's plan in our planning, and sometimes we're playing catch up for opening. I understand that there has been an opening of beauticians, hair and nail places, and I won't go into the details because I haven't had a chance to read it myself. But there is a slow, steady expansion. And this may have been said earlier, but I think it's worthy of repeating. When we say middle, it doesn't mean we're halfway through. What it means is we are in the middle phase. And in order to go to the next phase, there's things we must do. And we must continue to wear masks, wash our hands, avoid crowds. And if you are in a particular high risk group because of age, over age 60, because of lung, heart, diabetes, or kidney conditions, or under cancer chemotherapy, we highly advise you to be very thoughtful about what large group situations you're attending. As I discussed with the mayor last night, there was a large gathering on South Saginaw at the Veterans Club, and I'm sure I saw over 700, over 100 cars and over 100 people on both sides of Saginaw. I didn't see many people with masks. I didn't see much attention to social distancing. And remember, I said we are in the middle phase. Just because we have moved forward, we can always move backward. So we must be careful. And it also includes how we think about when we attend demonstrations, that you wear a mask, that you move around people who know you. Should contact tracing have to follow you, to see if you've come in contact with someone who's COVID-19 positive. All these precautions are not just to protect you, but to protect our loved ones and sometimes the people we don't love so much. But the virus doesn't draw any barriers, so we must be careful. I expect in the next 2 weeks, we will get a final report, and it lists for the Blue Ribbon Committee, and it lists explicit directions for each sector of our economy. So stay tuned. And if you have any problems with your water service, please call 810-410-2020. We have recovered from illness in our customer service section, and there should be people on duty who can help you now.
Thank you, Dr. Reynolds. And I'm so glad you brought up the issue of the water main break. I think it's really important that those of us that are on this webinar, particularly our outreach workforce, and those who are coming in contact, that they help to share these messages, because everybody doesn't get it in the same way. So you're so valuable to this work. We're still dealing with issues around our water. So the water filter and water test kits are still available. Dr. Reynolds, and
that is correct.
Okay.
And call 410-2020 if you need any of those that supply.
So is there an update also, Dr. Reynolds, on the curfew?
The curfew ended May 28th. Okay. And I thank all the residents and visitors to the city of Flint who cooperated with that curfew, because we cannot be successful without that cooperation. However, as I referred to that incident just this week, it does not mean that we should let our guard down. And whatever we bring in from the street, we bring into our children, our family, and our loved ones.
Dr. Reynolds, just while you're right there, one other thing, you mentioned flushing, and again, that's still an issue as it relates to the aftermath of the water switch, and we're still dealing with that. Is it important for the residents to continue to flush on a regular basis, even when there is not a water main break? Actually,
as the lead crisis evolved, I learned that this was a practice that anybody should do, especially after they've been on vacation, even over the weekend or for a week. You should flush your lines, because that brings in fresh water with disinfectant. I live in the city of Flint. I still flush 3 to 5 minutes, and at least until the warm water gets cold. I still use a filter, and I don't have plans to change that practice anytime soon. And frankly, when I go to any city, that's the first thought in my mind. How am I going to flush the line and how will I get purified or distilled water if there is a problem or if I'm uncomfortable?
Thank you. Thank you so much, Dr. Reynolds. And I just want to piggyback off of something else you said. You talked about over age 60. And so, you know, my children act like I'm a real fragile person now because I'm over age 60. But this is something for us to continue to consider how important it is when we're talking about flushing. But then you mentioned so for those with immune compromised systems, and then you mentioned that we bring things into our children. I want to just talk a little bit because there was a question about this reopening and what this means for the schools. The representatives from the city of Flint, nor the city of Flint schools, nor GISD, Genesee Intermediate School District, were able to be on with us today, but they wanted this message shared. They really want our residents to understand that they are making every effort and planning diligently for safe return of our students and the faculty to schools. And so here's some of the things that they're working on. They are planning based upon CDC guidelines to open school in the fall, but they are working very closely to understand what those guidelines are and to put things in place. The Michigan Department of Education or the State Health Department of Education have not yet provided the guidance for what that will look like explicitly in the fall, but they are believing that it will require smaller class sizes as well as a blend of face-to-face and some virtual learning. And so it's important at this time. I want to encourage families, if you have children, and those of you that are working with families, and particularly our community health workers that are in the school, and you're talking to the families, if they do not have adequate internet, there is work being done and offers being made by Xfinity for them to get free internet right now. So at least help them understand that that's available and they should work through that process. Talk to the company to make sure that that is available for them and their children. In addition to that, as we look at the other things that they're looking at, developing policies and procedures for how they will clean the schools, how the students in school and staff will interact while in schools, their protocols for health screenings, because as the children are coming in and out, they may have symptoms. And so they're working to figure out just what they will do if either the students or the faculty are identifying systems, and then looking at multiple ways to schedule options for the students. The officials will follow the guidance of CDC and the Michigan Department of and the Michigan Department of Education, as well as the Office of the Governor when they are making these decisions. So if you have any questions, you are encouraged to call the school that your child attends, call that administration to find out what it is exactly that's going on. But they are working to make sure that everything is done to ensure the safety of our students when they return to school. As we move forward, we're looking at, as this conversation, even with the students, what's that testing gonna look like when they come into school? Our health department has been a real leader in this area about testing. And so Suzanne Cooper, who's been on with us every week, and thank you so much, Susan, and all of you, is gonna lead this discussion for the health department today, talking about the sites, updates from the county from a health perspective, the sites that are open for us. There's some new sites, I understand Susan as well will share with us. Suzanne, please.
So let me start with some basic information about numbers, some key messages, and then I'll talk a little bit more about the testing location. So every day we post to our website the new data related to COVID-19 in Genesee County, and we do that at 2 p.m. As of yesterday, our post was for 2,050 positive COVID-19 test results with 249 deaths. And I remind everyone that because we've had limited testing, this is not a true reflection of the total number of COVID-19 cases that have likely been in our community. So that's key for us to think about. I will say that the number of people who've gotten tested has increased. That's really important. But there are 5 key messages that the health department would like you to remember and think about as we move forward in the fall. Many of them repeat what Deborah Verholden and Dr. Reynolds have shared, and I want to say them again. It's critically important that everyone have a medical home. a safe and comfortable place for you to talk about your health and get key advice on whether or not you need the COVID-19 test or the antibody test. But work with someone who knows what your health status is and can guide you as you need to seek health care, particularly as we get into the fall when we may have a second wave of COVID-19. Second is how important it is for people to get tested. And as the testing criteria loosens and there's more opportunity for everyone in our community to be tested, we please encourage you to do so and recognize that a great number of people who've been tested did not have symptoms and did test positive. For those individuals that have participated in protests, please go and get tested. Be protective of not only yourself, but of those that you love that are around you who might be more vulnerable. Recognize that when you do get tested, the health department will follow up to do what's called contact tracing. And the health department will ask questions about your health. They will help guide you with appropriate guidance to take care of yourself, but they'll also seek information about who you were with when you were contagious so that we can reach out to those individuals as well and help protect them. We want to make sure that you know the health department does ask personal questions about your health and about those that you've been in contact with. But if you get a call and someone asks you about financial information, for example, your bank account, your social security number, anything related to billing or anything related to credit cards, hang up. That is not someone from the health department. They will never, ever ask you about financial information. We want to remind everyone that COVID-19 is not going away because the economy is reopening, that we are going to be living with this virus until we have a vaccine or treatment. So it's really important we continue to take those preventive measures, to wear our masks, to social distance, to wash our hands, use hand sanitizers, not touch our face, wipe down frequently touched surfaces, all the things that you've heard us talk about earlier. We must continue to do those and to ensure our health. But we also want to make sure everyone is taking care of their health, taking advantage of those preventive screenings, eating well, exercising, and most importantly, as we get into the fall season for flu, we encourage everyone to get a flu shot so that you can keep yourself healthy and more able to protect yourself against the COVID-19 virus. So having said all of that, we are working very hard and making sure that we have testing locations available in our community. And I will remind you of the sites that are currently available. We have the Rite Aid Pharmacy in Swartz Creek that is open daily, 9 a.m. to 5 p.m., and the Flint location on Clio Road, which is open Monday through Friday, 10 a.m. to 8 p.m., and Saturdays and Sundays from 10 a.m. to 5 p.m. Those appointments are made through the Rite Aid website. We also have the Hamilton Community Health Network, and they are providing screenings at both the North Point Clinic and the Burton location has now been moved to the fire station that is at the corner of Bristol and South Saginaw. All of these are made by appointment for Thursdays and for Tuesdays, and you can call Hamilton or you can make an appointment through their website. Their number is 810-406-4019. Hamilton is offering both the COVID-19 test and the antibody test. But when you call to make an appointment and you go through the screening process, you will be guided to which is the appropriate test for you. Michigan Health Specialist is offering testing at both of their locations in Burton and in Flint, again, by appointment, Monday through Friday, 9 a.m. to 5 p.m. Their number is 810-235-2004. The Walmart on Corona Road in Flint is offering testing Monday, Wednesday, and Friday, 7 a.m. to 9 a.m. Again, by appointment. You can connect with them via the Quest website or 866-448-7719. We have had a Kroger testing location that has been in the Grand Blanc High School parking area. That location will be moving, and we'll be providing you with additional information as it becomes available. We also know that in the next few weeks, additional sites will be coming online, and we'll be sharing that information as soon as it's available. There are testing locations available in our community. There is ample testing, so we encourage everyone to please take advantage of it. And again, if you participated in a protest, please make sure that you have the opportunity to get tested to protect not only yourself, but those. I also wanted to share with everyone that on Wednesday, the Genesee County Board of Health passed a resolution that was introduced by Dr. Kent Key of Michigan State University, declaring that racism is a public health crisis in Genesee County. Thank you.
Thank you so much, Suzanne. This is, again, a really critical issue, the testing and the fact that we have this number of test sites in our community because our community has been so hard hit by the virus. And yet it's not enough to get tested that one time. So let's utilize these sites so that we can continue to offer this service. Now we're talking about testing because the following testing is contact tracing. And a little bit was spoken about that in a couple of spots already today, but Kim, would you please kind of give us an update of last week's presentation, but some nuances that came up that you wanted to make sure that our participants are aware of?
Good morning, Yvonne, or good afternoon now. Yes, and thank you. Just quickly a reminder that this is not a new process for the health department. This is a common occurrence that we take forward and a common method that we use for multiple different processes. All types of communicable diseases follow the same type of outbreak investigation, and such as HIV, foodborne illnesses, like I mentioned before. That is nothing new. As Suzanne mentioned, if you have a positive COVID-19 test, we will be contacting you from the health department to collect more information. We do ask personal information as far as your identification, your name of birth, phone address, those types of things. And then we do ask for your contacts, those people that you've been around, your loved ones, your friends, your family, and we do put that information into the state database. And then the state database pulls that information and uses that to do the contact tracing. And actually, go ahead and go to the next slide there, Yvonne. This is really where the updates and the couple of pieces of information that I've gained since our last presentation. Actually, the next one too. Sorry, Yvonne. The My COVID Help slide is where we start with our updates. So what I have learned since the last time that we talked about this is when the state calls to do the contact tracing information, the My COVID Help that will show up on the caller ID actually only shows up on a landline phone. I don't know about you, but I haven't had a landline phone for a couple of years. So we've gotten several phone calls over the last week or two from family members and friends of people who have been diagnosed with a positive COVID-19, calling to ask us because they're getting a call from a 1-866 number. I have verified this with the state, and one of my nurses actually called the number back. And so if you have a cell phone, you will likely see on your caller ID, it is a 1-866 number. They should still give you the information that they are calling from the My COVID helpline. If you want to make sure that it really is legitimate before you start answering their questions, if you call that number back, it will give you a message that the caller was calling from the My COVID Help contact tracing team. And so if they call the first time and you're just not comfortable, you can tell them that you want to track the number, that you're going to call the number back, and could they call you tomorrow? And once you've verified that they're calling from the state, then you can go ahead and answer the questions. So that was the big change from this slide. Again, just to review, they will want to verify your name and your date of birth to make sure that they're talking to the correct person. They likely could ask you to verify your address because if we have information that we need to get out to you and for some reason your phone is not working, we will mail it to you, as will the state. They do contact tracing for 14 days. They will contact you 14 days in a row to check on your symptoms. They'll want to know if you have been having a fever or chills, signs of a fever, or if you've had any cough or sore throat or any of the other minor symptoms that are related to COVID. And then they also will give you an option to do the automated text where they will text you those questions and you can text the answers back. And then just a reminder, as Suzanne already mentioned, no agencies from the state or from the county in regards to COVID-19 will ever ask for financial, tax, or social security information. And one other question that came up between last week and this week is, are the calls recorded? And I have double checked that as well with the state, and the calls are not recorded. So we want to get that message out there along with this message. Please, please encourage everybody to answer the calls and let them know that we got their number because a family member or a friend gave us their name because they were worried, because they were tested positive for COVID-19, and they want to make sure that they have the correct information with what to do, what to watch for, and where to go to get tested. And that's the updates I have. Yvonne, any other questions for you?
Well, thank you, Kim. And I just want to say how important it is that we do get the calls and the questions from those who participate in the webinars, because the insights that we got from last week's questions helped us to be clear about this. And so we need you to help us. Messaging is so critically important. If we don't get the right message out, we won't get the right outcomes. And, tracing is a tough word. And within the environment we live in, not many people want to be tracked or traced. But if that message that you send is, this is a call because someone cares about you enough to let you know that there might have been a potential exposure, it's because they love and care about you. The message has to be that clear. And yet we want people to be cautious. So thank you so much for that, Kim. This leads us now to better understanding some of the things that the state is doing. We know that the governor has a plan, and we are thankful that Gary is so diligent about coming and giving us the updates. We know the governor made an update even at 11 o'clock today. So Gary, can you tell us what new or expanded messages are coming from the executive office of the state through by Governor Whitmer?
Yeah, sure thing. Thanks, Yvonne, and good afternoon to everyone. So currently we are, as a state, at total confirmed cases count 58,241. Total COVID-19 related deaths are at 5,595. And total recovered COVID-19 cases as of May 9th are now at 38,099. And just as a note, recovered is defined as the number of persons with the confirmed COVID-19 diagnosis alive 30 days post-onset. And so recently as of this morning, the governor appointed Sean Egan to serve as the Director of COVID-19 Workplace Safety. So in addition to this role, Sean is also the Deputy Director for the Department of Labor and Economic Opportunity, where he oversees MIOSHA, Workers' Disability Compensation Agency, the Bureau of Employment Relations, and the Wage and Hour Division. This appointment follows an effort to ensure that Michigan workers are protected as the state slowly and safely begins to open different sectors of the economy. The governor also recently signed an order reopening more regions and economic sectors under the My Safe Start plan. So starting on June 10th, Regions 6 and 8, which includes much of the northern Michigan and all of the Upper Peninsula, will advance to phase 5 of the governor's My Safe Start plan. And on June 15th, personal services, including hair, massages, and nails will reopen statewide. Additional food assistance for 350,000 Michigan families in response to COVID-19 emergency has been extended through June. So approximately 350,000 Michigan families will continue to have access to food assistance benefits during the month of June as a response to the COVID-19 pandemic. And this was an announcement that the governor and the Michigan Department of Health and Human Services recently made. The governor also announced a plan for police reform to promote racial equity. This announcement was the governor lending her support for a series of policy plans for police reform in Michigan, calling on Michigan law enforcement agencies to enhance their training and policies to help create a police culture where all Michiganders are treated with dignity and respect under the law. Whitmer also voiced her support for measures that require law enforcement officers to complete training on implicit bias and de-escalation techniques, and applauded the Senate for taking up Senate Bill 945, which addressed many of these issues. The governor also urged police to require their officers to intervene when they observe an excessive use of force by another officer, which will stabilize and help to keep people safe. The governor also recently appointed educators, parents, as well as students to the COVID-19 Return to School Advisory Council. So this was an announcement of a group of about 25 leaders in healthcare and education to serve on the COVID-19 Return to School Council. The group, of course, includes educators, parents, and students who will work closely with the governor as she continues to put the health and safety of our students and educators first. Also, there was an extension of an executive order for allowing administrative hearings by phone and video conference. And so this will continue to allow certain state administrative hearings to be held by either video conference or phone in place of in-person meetings. And this order will be in effect until June 30th. The governor also recently rolled back some COVID-19 executive orders pertaining to FOIA, hospital capacity, and ambulances, as well as loosened some MDHHS visitation rules in hospitals. So this an amount of rescissions of executive orders on FOIA, hospital capacity, emergency medical services, and MDHHS loosened rules on who can visit patients in certain healthcare settings as regions across Michigan continue to advance under the My Safe Start plan. Also, the governor requested to put in a request for extended use of the Michigan National Guard to combat COVID-19, and it was approved by the president. So the Michigan National Guard will continue its efforts to combat the COVID-19 pandemic after the president extended the federal deployment authority until August 21st. So this extension came as a result of the governor sending a letter to the president on May 27th urging the extension. And so the Guard has played a critical role in flattening the COVID-19 curve in Michigan by distributing personal protective equipment, food and medical supplies, providing warehouse support, disinfecting public spaces, and assisting the Department of Health and Human Services with testing. The governor also called upon the White House to help states with testing and budget shortfalls in a testimony she recently gave to Congress. And so in this testimony that was delivered remotely before the U.S. House Energy and Commerce Subcommittee on Oversight and Investigations, the governor called on the federal government to help states like Michigan ensure and promote widespread testing for COVID-19. The governor also echoed her calls on the federal government to help states address the significant revenue shortfalls they are facing after dedicating resources to saving lives and protecting frontline heroes. Also, the governor recently signed an executive order to protect migrant agricultural workers living in congregate housing. And so via this executive order, it provides additional requirements and procedures to keep agricultural workers and the food supply safe from the effect of COVID-19. The governor also, along with the Department of Insurance and Financial Services, announced an order requiring auto insurance due to COVID-19. So the governor and the Michigan Department of Insurance and Financial Services recently announced through the director of the organization, Anita Fox, ordered all auto insurance in Michigan to issue refunds or premium waivers to consumers as a result of insurance companies' reduced risk due to extreme reductions in during the COVID-19 pandemic. And also the governor signed an executive order extending protections for consumers, grocery store employees, and vulnerable residents. So signing this executive order extended existing safety measures to protect consumers and employees at grocery stores and pharmacy, and maintained restrictions regarding entry to care facilities designed to protect vulnerable populations while allowing the director of the Department of Health and Human Services to gradually open visitation as circumstances permit. And as always, michigan.gov/coronavirus is the best website to stay updated on everything. Yvonne, I think you're on mute.
Okay, I'm sorry. I'm trying to listen to you. I put myself on mute. So Gary, you mentioned that one area, the fifth area, containment, and that's one of the reasons why the governor is continuing to start opening things up, because we are seeing a reduction in the number of cases and we're seeing some improvements. You mentioned that there are 38,099 people who are recovering, and I think this is an important element for us to understand. We know that because they were tested, and now we can see that. So this is getting us really to keep in mind the importance of testing in our communities. And this is part of what's helping to go through these stages that the governor has put in place. So the other order that's here is still in place, the stay of evictions, that's still in place. And then we want to just also encourage those individuals that are having some challenges. Don't wait until it's too late. Call this, go on this website now or call the number. And I want to go back to Gary's opening slide, if you will, and let's get those numbers so you can see. If you have questions about anything that he has provided for us today, if you would please give him a call. This is his number here on the screen. And Gary, give it to us again, because I don't think we changed it. 282-3193, right?
Yeah, it's 517-282-3193. So
3193. But you can call him directly and get that information regarding the governor's efforts to ensure that our community is safe. Our communities in the state of Michigan are safe. Want to just now move again to thinking about ways that we can stay safe. And we have our phenomenal Dr. Susan Woolford, who is going to provide for us a clinical perspective. We've talked about children today. We talked about opening up the schools. And so Dr. Woolford is a pediatrician. And I'm telling you, every time I talk to her, you can just see her sense of why she cares so much for babies, and how I'm sure in the moments when things are in crisis in the hospital, she can soothe the parents because she provides this comforting words for them. But Dr. Woolford, can you just take a few minutes now and tell us something that's really important about what we can do to help our children in this crisis? I think you need to unmute yourself, Dr. Woolford.
Here we go.
Can
you hear me now?
Yes, we can.
Oh, excellent. Thank you so much, Yvonne, for this opportunity to speak about some things that are near and dear to my heart. So there are lots of public health advances that account for the fact that we are all living longer. Clean water, sanitation, and good nutrition. And of course, those are particularly important all now during the COVID-19 pandemic. But we also owe a lot of the advances to health to immunizations. And so I think it's really important for us to pay attention to the fact that immunizations currently are going down. So in studies recently, looking at data out of Michigan, we have to give our props to Michigan because they're one of the first states to collect these data and to publish them. But if you look at children at pretty much any age, the number that are up to date in their immunizations have decreased. So I've just shown here for 5-year-olds, generally 2 out of 3 are up to date with their immunizations. But when they looked at this in May of this year, only half, just less than half, were up to date in their immunizations. And this is very concerning. because those who are not immunized are at risk for a host of illnesses. In fact, there are about 16 things that we protect against with immunization outside of COVID-19 that children can fall prey to that we want to still protect them from. I just want to mention a couple here. Diphtheria. No one ever sees diphtheria. No one knows what diphtheria is because immunizations have worked so well. It causes a thick membrane to cover the back of one's throat and nose and is deadly. In 1 in 10 cases, patients die, and it's more if they're less than 5 years of age. So we don't want a resurgence of diphtheria in our country because we're not getting immunized. I'll just mention one more, whooping cough, pertussis. It causes all the things you see on the screen, and 90% of deaths from pertussis are in patients less than 1 year of age. Again, and this is something that many adults have, and we spread it to children. If they're not immunized, then they are at great risk. It's very important to me at this point because in our current discussion, there's a lot of attention, quite rightly, on the disparities that are in existence in our country. And these affect children to a great extent as well. If we look at deaths of children from 1 to 19 years of age, we see that African American children are more likely to die than any other race. If we look at infant death, Black infants are 2 times more likely to die before their first birthday than are their white counterparts. So we have to do everything that we can to not let their light go out too early. One thing we can do is to immunize on time. My call to action today is do not wait, vaccinate. Thank you so much, Yvonne. I think you're like me on mute right now.
You're muted. Yeah.
I'm sorry, I've gotten so involved. But before you go away, Dr. Wolford, let's just take a moment here and clarify. For infants, there are some immunizations they can receive, but then there are others that they cannot receive until they're 6 months old. So the mother's immunization is, especially while pregnant, are critically important to the health and well-being of that early child's life. Can you talk about that a little bit?
Absolutely, that's a very good point. I'm so glad you raised it. Adults need to immunize themselves as well. So mothers need to get immunized while they're pregnant to be able to protect the child. Also, breastfeeding helps to pass on some of those immune factors to babies. So that is an excellent thing to do. But not just mothers, but anyone who's around the child, parents, grandparents, friends, anybody. They all need to be vaccinated because by being vaccinated, you protect the baby and others who cannot get those vaccines. So as I believe Dr. Reynolds mentioned, while you're out protesting, while we're out because we cannot stay in completely, make sure that we help protect children by doing the best we can to protect our health, which is vaccinating and doing all the other things that we've mentioned.
Thank you so much, Dr. Wolford. These are very important insights that we're sharing. And it really points to the fact that there's something that all of us can do. And we're not only looking at protecting our own life, which is very, very important because I want to live to be very, very old. But I also understand that what I do is important to protect the life of other members in my family and other members of the community as well. So it's important that we have medical homes. And then as we look at our community partners, the perspective of community partners, we talked about this last week, a medical home. And I know, Nicole, you're on. Can you just give us a quick update about CHAP and that program? And then we're also gonna talk a little bit about, ask Jim Melanowski to come to unmute to talk about what's happening at the health plan. So Nicole, talk to us a little bit about the importance of the work CHAP is doing to ensure a medical home for those that they serve.
So what's been kind of fantastic is we've heard from multiple partners throughout this call the importance of connecting to your physician, to having a medical home, to making sure that you're participating in those preventative health behaviors. And so CHAP is really designed to connect individuals to their medical home. And so if there's someone in our community that you know may need access to their primary care provider or some assistance with insurance or anything like that, all you have to do is call CHAP. It's 810-953-2427, and it's actually 2427 spells CHAP, which is kind of cool. But we have a slew of social workers and community health workers and nurses that are really there waiting to make sure that our residents are connected to the services and their primary care providers. Yvonne keeps muting herself today, guys.
Yes, because my phone was dinging and I didn't want everybody to hear that. But thank you so much, because the Greater Flint Health Coalition also works with the registry, which is another opportunity for us to identify resources and services that are available to us in the community. So we appreciate that work that's being done. Jim Melanowski from the Genesee Health Plan, can you give us an update today, please?
Well, real quick, yes, we are still assisting people. You need healthcare coverage to go to the doctor, and we want to make sure people have their healthcare coverage, healthcare insurance, and so our staff is available to assist 810-232-7740. But real quickly, in this new world that we have, and they just, they're really wanting people to go and get their visits, but that might be a little bit different. It might not be like it used to be, calling in. There's certain new registration processes and screening at the door. And so I just wanted callers to be aware that that might be a little bit different for people, and they should, contact their primary care physician or their clinic that they go to, their dentist. They might have different requirements and might do some of that virtually or by phone as far as some of the registration. So it might be a little bit different for them, Yvonne, and I kind of wanted to make sure people knew about that.
Yeah, Jim, I think you're right, and we're seeing that in a lot of places that there's different levels. You can go and fill out a piece of paper, but you may have to go back out to your car. You may go and they'll ask you to actually text them information before you come in.
Right.
And so this is a challenging time for all of us. And I remember we had a conversation yesterday, and it's like we're working on this, and even earlier this morning, we're working on this as we go. So it is incumbent upon all of us that we speak to what these issues are, but also we're offering some solutions. If you're in a process and it's not working quite right for you, I think it's important that you know that you can share something didn't go quite in the way that you needed it to go, so that those who are providing the services can make the necessary adjustments.
Yes,
And
Yvonne. So don't be deterred. Don't stop going to the doctor because of some of these new additional things that are in place at the offices. Call us or call CHAP and the Greater Flint Health Coalition to talk to their navigators to get you into care.
Thank you.
Yep.
And I also recall, and Susan, Dr. Wolfer, you when you were talking about the children and getting them immunized, we were also in conversation this week that many people are not going to the hospitals, and they're not even going to their doctors because of fear of COVID-19. It is important that we continue. If you have a health condition that you know you need to go to your physician about, please do not hesitate to make that phone call to your primary care or even go to the emergency if it's a need. They are working diligently to ensure that they're doing the things that are necessary to protect you. But we don't want to die at home because we didn't go. So as we learn this information, we're asking you to take real care of how you interpret the information. Ask questions is the best thing that we can all do, is to ask questions so we're clear. We thank you for coming and being a part of our webinar today. We appreciate those that put questions in. I see a few more questions in the queue. In these next couple of minutes, our panelists will stay on to respond to those questions for you. You can help us by responding to the post-webinar survey that will come up immediately following the webinar today. complete that. As you're completing that, it helps us to respond to your questions. One quick question was, can I open my doors and let the sun come in? Now, we don't have all the clinical answers right now, but please get a little sunlight. If FedEx and those folks are coming to your door, just be careful. You know, we say spray down your boxes before you bring them into your house, but let's make some wise decisions. But if you have those questions, please feel free to send us those questions and we'll be happy to answer them. Join us next week. June 12th, we'll be right back here in this webinar, the Flint Community Webinar on Coronavirus, with you and those of you that you invite to participate along with us. Again, we cannot express our appreciation for you in this time. Let's be mindful. Let's be courageous. Let's make good decisions. Protect yourself and protect others as well. Again, thank you for joining, and we'll look forward to being here again with you next week.